Hello, my name is Zainab Sabreen, and I will be discussing the role of a nurse practitioner. To begin, nurse practitioners have been providing care since the 1960s. This role was a result from the shortage of primary care physicians serving the pediatric population. Initial education requirements included a range of 3 to 12 months and expanded with the development of the role. By the 1990s, a master's degree was considered an entry level for a nurse practitioner. Additionally, nurse practitioners are the largest group of advanced practice nurses, with 355,000 nurse practitioners that are licensed and practicing. Between 2020 and 2030, the demand for nurse practitioners are estimated to increase by 52% due to the shortfall of more than 20,000 primary care physicians. By 2025, 37 states are projected to have a shortage of primary care physicians, so that's where the need for nurse practitioners will come in. The role of a nurse practitioner was formally developed by Loretta Ford and Henry Silva in 1965. The first program was a pediatric nurse practitioner program, teaching nurses how to provide primary care and make medical diagnosis. Nurse practitioners are one of 4 roles that fall under the definition of an advanced practice registered nurse, or APRN. The role of a nurse practitioner is to assess, diagnose, and manage an array of health conditions. They also emphasize health promotion, disease prevention, and patient education. In addition, they perform physical exams, order and interpret diagnostic tests, prescribe medications, and develop individualized treatment plans. They can practice autonomously or in collaboration with other providers. Nurse practitioners can be found in a wide variety of practice settings, which include primary care, acute care, hospital systems, long-term care and rehabilitation, universities and academic institutions, and specialty clinics as well. Next, we'll discuss the consensus model for the APRN role. In 2008, the consensus model for the APRN regulations, licensure, accreditation, certification, and education was finalized. The consensus model aims to standardize the regulation of APRNs across the United States. It outlines the requirements for licensure at accreditation, certification, and education to ensure consistent standards across the board. This model advocates for NPs to practice with full authority. The goal of this framework is to expand access to care. And lastly, this model sets a national standard, but implementation varies across from state to state. The educational requirements of an NP include completing an advanced nursing degree, either a Master's of Science in Nursing, MSN, or a Doctor's of Nursing Practice, DNP. MSN programs can take 2 to 3 years, and DNP programs can take 1 to 2 years beyond an MSN program. The core coursework includes advanced pathophysiology, advanced pharmacology, advanced health assessment, clinical decision-making and diagnostics, and population-focused specialty courses if an individual chooses to specialize in a population focus. Clinical practicum requires a minimum of 500 to 700 hands-on clinical hours as well. The National Organization of Nurse Practitioner Faculties established core competencies to guide NP programs. There are 10 broad competency domains, which include knowledge of practice, person-centered care, population health, practice scholarship and translational science, quality and safety, interprofessional collaboration and practice, health system, technology and information literacy, professional acumen, and personal and professional leadership. NPs are required to hold a registered nursing license and complete an accredited nurse practitioner program. Each state has specific licensure requirements, which may include passing a national certification exam and meeting educational prerequisites. Certification is essential for nurse practitioners and serves as proof of advanced clinical knowledge and skills. Maintaining certification involves fulfilling continuing education requirements and periodic recertification to ensure NPs stay current with clinical practices and standards. In addition, NPs must adhere to legal regulations that define their scope of practice, which includes prescriptive authority, patient management, and clinical decision making. Some professional organizations that represent nurse practitioners play an important role in advocating for the profession, providing continuing education, and supporting nurse practitioners in clinical practice. A few of the professional organizations include the American Association of Nurse Practitioners, which advocates for nurse practitioner practice autonomy, provides continuing education, and offers networking opportunities. The AANP also engages in policy development and legislative advocacy to enhance the NP role. They advocate for a full practice authority in many states. Another professional organization is the National Organization of Nurse Practitioner Faculties, or non-PF, which focuses on promoting excellence in NP education. This provides resources for education and helps develop core competencies to ensure NPs are well prepared when they practice. These organizations advocate for more comprehensive roles for nurses, promoting interprofessional collaboration and improving the quality of care for patients. They also help shape healthcare policies, which in turn work to have a better working condition, safety standards, and healthcare access. Next, we'll discuss a biblical worldview perspective. A biblical worldview can align closely with the role of a nurse practitioner by emphasizing principles such as compassion, service, stewardship, and the integrity and the inherent dignity of every person. These values are integral to nursing and can guide nurse practitioners in providing holistic and empathetic care. Key implications include contributing to a positive and supportive work environment, resolving issues constructively, and gaining the trust of patients through professional integrity. Parse's human becoming theory, developed by Rosemary Rizzo Parse, emphasizes understanding health as a constantly evolving process shaped by personal meaning and the choices people make. Focusing on the concept of meaning from Parse's theory, this principle is particularly relevant for nurse practitioners because it emphasizes the importance of understanding the patient's unique experiences, beliefs, and values. According to Parse, health is defined by how individuals perceive and give meaning to their health experiences. Therefore, to provide effective and compassionate care, nurse practitioners must seek to understand each patient's perspective, acknowledging that health and well-being are subjective and personalized. It enhances the NP role by utilizing a patient-centered approach, building trust and therapeutic relationships, and empowering patients to make informed decisions about their care. Incorporating the concept of meaning from the human becoming theory enhances the NP's ability to provide comprehensive and compassionate care. So in this presentation, we explored various aspects of the nurse practitioner role, emphasizing its core competencies, ethical considerations, integration of a biblical worldview, and the application of Parse's human becoming theory. The NP role is a cornerstone of modern healthcare, blending clinical expertise, patient-centered care, and a holistic approach. By adhering to core competencies, ethical principles, and compassionate care values, NPs make a meaningful difference in the lives of their patients, contributing to a more accessible, equitable, and effective healthcare system. And lastly, these are the references used.